Thank you. I'd like to start us off in a good way by opening with having a traditional opening. Megan, are you here?
Yeah, I'm here.
Hi, Megan.
Honey.
Megan Lotka is our works for the Center of American Indian Minority Health at the University of Minnesota Medical School. She is our community liaison, and she is Anishinaabe from the White Earth Nation. Go ahead and take it away, Megan. Thank you.
All right. I just want to show you guys my asema I have for our prayer today. So keep your thoughts into this, and it's blowing away in the wind, so that's pretty great, I think. Okay. Anin and nada we magana idug. We gwitch gitchimana do nungam. We gwitch wabadong. We gwitch gwadanong. We gwitch shabanong. We gwitch nagabi anong. We gwitch namama aki. We gwitch Jesus. We gwitch tabika Jesus. We gwitch niben nuden ishkode. Gagawe jimagu. Je weje bemoseyag. Mikanayag chi mano. Bemadize wang. Gashkabadano ode mashkaki. Minawa gikenu imade win nungam. Mi u mi gwitch aho. So in that prayer, I said, hello, my relatives. I said, thanks to the Creator for today. I prayed in our 4 directions since we're all gathering together. I prayed to the earth, to the sun, to the moon, to the water, to the wind, to the fire. I asked the Manadus to walk us on the path of a good life and to help us carry in our hearts the medicine and the education that we bring to each other.
Buenos dias, Megan. Miigwech. Pludash uhat duasok, wishkatana hatsiti, haitidach, ayahat, akwandach, ayahat. My Tlingit name is Dludash. I'm named after my grandmother, Marie James. My English, and I'm from the Thunderbird House of the Shark Clan of the Akwon tribe of the Tlingit people from Southeast Alaska. And it's a pleasure to see all of your beautiful faces today. I'm also the Associate Dean of Native American Health at the University of Minnesota Medical School and the Director of the Center of American Indian and Minority Health. I want to welcome you all to the Indigenous Health Education and Resource Taskforce 2024 Virtual Summit. We're thrilled to have still over 200 registrants, which is pretty good or great actually, and but not too surprising given the high need that we have in our communities for our own representation in healthcare. It's also not surprising given how much we know that our students need and deserve our collective support as they navigate the this educational system that isn't always about and for them. For those of you who've been with us for the past few years, you know that like our students, we've also had a little bit of a rocky go of it, a rocky start, a little fits here and there, fits and starts here and there, but we've mostly been focused on uniting both at the national and the regional level and finding out, discussing together what the issues are, not only national, but within each region, recognizing that the regional differences are sometimes significant. But last year, we were fortunate enough to get funding from a very generous funding from the Robert Wood Johnson Foundation, about $1 million, that allowed us to move a little faster or more smoothly, I guess. And we were able this year, to hire both a communications and a program manager who you'll meet here in a couple of minutes. And they have been focused this past several months on going around to meeting us at the national level, but also going around to each of the regions to meet you all and to hear about the issues. And their job is focused on helping you right now on coming together and being able to have these important discussions and generate the work that you'll have over the next several years. They've also, though, been primarily responsible for putting together this marvelous agenda that you see in front of us. Thank you to both of them. The agenda over the next 2 days is full, and it's going to be have some fun things in it, as well as the regular work that we always do. The fun things are that we get to see a logo finally, and you'll get to decide on what logo exactly that we choose. We've narrowed it down to a few. So kind of exciting part of the workshop. But again, as importantly, we'll have opportunity to talk with each other, both in our regional and then also share out at the national level some of the ideas that we've come up with, as well as the unique problems that we're all dealing with in our areas, in our regions, and again, nationally. But before we get too far, I'd like to start now. IHEART is a collaborative effort. It started a couple of years when I was the president of the Association of American Indian Physicians. We recognized that we'd been having conference after conference talking about all of the issues and problems that we face in getting more representatives for or getting ourselves represented in healthcare, and we're not making much change. So we wanted to come up with a new way to do that. And AAIP joined with several other programs or institutions to make this happen. I'm going to introduce them now. One person I don't see on here, but I would like to introduce and have him introduce himself or mention his role in this. And that's Tom Anderson, from the executive director from the Association of American Indian Physicians. Go ahead, Tom.
Thank you, Dr. Owen. It's a pleasure to be here today. It's exciting. This is an exciting journey. And I want to hold up high Dr. Mary Owen, who stewarded this concept from day one. And even though the baby's dropped a couple of times, it's still intact and well alive. The Association of American Indian Physicians is pleased and proud to be a part of this effort. So thank you, Dr. Owen.
Miigwech, Tom. I'd like to introduce or ask her to introduce herself, Dr. Norma Pohl-Hunter.
Hi, everyone. Good morning, good afternoon. On behalf of the Association of American Medical Colleges, it's my privilege to be here with you today. IHEART really was a vision that was started by natives for natives, but with allies like AAMC, who are really committed to ensuring not only the representation of Native communities, but the active engagement and elevating the voice. So we see this as very critical to our mission to advance the healthcare of everyone in our nation and beyond. And we know that we cannot do that without having the Native voice and engagement, not only for Native communities, but for all of our health. And so really, as a sponsor, as a collaborator, as a friend, we say thank you for allowing us the privilege to work with each of you to really help to make this come to fruition, to ensure that we are working together, but also centering the voice of your communities as we do this work. So again, it's been a privilege. And I also want to acknowledge Kimberly Bellamy on our team, who's been really engaged in this work as well. So thank you, Kim, for your dedication. And I'll hand it over to our other colleague who's really critical to this work at the American Indian Higher Education Consortium, Reno Charette, to introduce herself.
Hello, I'm in Billings, Montana, and I am the Health Initiatives Director for AHEC, and AHEC has been part of this collaboration since its early beginnings. And it was my fortune that our CEO at AHEC asked me to be involved. We promote tribal colleges in this effort as much as possible, but we also realize that without the collaboration of many others, this team and those of you in the regions, that we will not make any change on reducing the number of students who drop out from their health career trainings unless we all work together. And I very much champion the idea of passing our students from one to another personally, from one deadly auntie to the next. We will get more nurses and we will get more physicians and the other careers that our Indian country needs desperately. I will see some of you in the meetings for the Northern Plains region and look forward to hearing your comments throughout the summit. Thank you for being here.
Miigwech, Reno, we don't want to leave out our deadly uncles as well.
Oh, that's right. Yeah, they're coming out of hibernation, I think.
Thank you. Stephanie Dobos, would you please introduce yourself?
Thanks, Mary. Happy to do so. Greetings, everybody. It's nice to see a lot of familiar names in the participant list. My name is Stephanie Dobos. I am one of the 2 new people that Dr. Owen talked about earlier. I am the program manager for IHEART, full-time, 24/7. That is my commitment. I am housed out of the Association of American Indian Physicians. I'm not a physician, but that is where I hang my hat officially. And my goals for this program, I studied leadership in practice in graduate school. And my goal is to form partnerships with like organizations and to create a coalition moving forward to kind of see what we can do to improve some of these health disparities via the healthcare workforce for Native peoples. And I'm very excited to be here. I'm sure you'll all get to know me better as the year goes on, and my inbox is always open.
Miigwech, Stephanie. Izzy, can we hear from you?
All right. Hi, everyone. My name is Izzy Burke. I'm operating out of AHEC with Reno on the Health Initiatives team, where we manage a couple of other grant projects in addition to IHEART. But it's a pleasure to be able to be on this team, working across, multiple organizations and to see the kind of teamwork and just the care that's coming from so many different places for the work that we're doing. It's very wonderful to see that kind of level of engagement from so many different people. So I'll be your communications coordinator. So anything that you need related to outreach, both internally and externally, that's going to be me. And I'll be presenting a little bit later in the summit to share a little bit about our upcoming plans for that. And I believe we also have Brianna Baldwin should be in the meeting as well. So I think we can go to her next before moving on.
Hey, hi everyone. Can you hear me?
Mm-hmm.
Okay, great. Yeah, it's AIA Brianna Inishia. Isatlana Nishle, Bilagana Bashichi, Torich Ini Dashiche, Bilagana Dashnale. Hello everyone. I am a 3rd-year medical student here at the University of Virginia, and I'm a citizen of the Navajo Nation. And I'm national president of your Association of Native American Medical Students. And our association is involved with collaboration, connection, and supporting matriculation and just support throughout graduate school for natives going to the health professions. Our largest constituency does contain medical students. And last time we checked our roster, we currently have members from representing over 100 tribal nations. And our work in the past year has really focused on trying to support and create mentorship for those coming from tribal colleges and coming from schools that are like trying to do more outreach for K-8 schools. Myself, having undergone education at a BIE school on a reservation, I am very passionate about that project. And we've also extended our mentorship and our membership recently to pre-medical students and have been hosting mentorship opportunities and support for them. So that's been our focus, and we're happy to collaborate with anyone here. If any of that sounds like work that you're doing and you want to work with us and our medical students and our other health profession students. Thanks.
Thank you, Brianna. Happy that you guys are also a part of IHEART. I want to emphasize you all heard from different folks that are the founding members of IHEART, but I want to emphasize the collective nature of IHEART. This is not just about making more physicians, it's also about making more dentists, pharmacists, nurses, because we need all in Indian country, as most of you are aware. And I would like to think, and I think it's really important that we think of the center of this work really being the tribal colleges. We know that that's where many of our students start, who are so committed to our communities. So I can't emphasize just how important it is that AHEC be part of this, and really much of our efforts focused around them. It's where one of our communications person Izzy is located. And just, I think, the hub of so much of what we do. And like Reno says, she mentioned one of her great ideas was the Auntie-Uncle Network. We don't know quite how to formalize that yet, but it's just one great idea that comes out of an Indigenous-focused institution, Indigenous-centered institution like the tribal colleges. So miigwech, and I'm so happy that they're part of our effort. I'd like to also recognize the people who have been doing this work for a couple of years before we actually had paid folks to do it outside of our institutions, and that would be Kirsten Olson. If you're on here, can you wave your hand? There she is.
Hello.
Thank you, Kirsten. Kim Bellamy, I know you were recognized earlier, but I don't think we can overstate how much you've done for us. Amanda Dion. And is there anybody else I'm missing? Norma? I think we've got them all. Okay, excellent. So we had our last person was Brianna was part of ANAMS, and that's a perfect segue into our next session. It's going to be another, folks have told us many, many times how important it is to hear from the student panel. So we're going to have another student panel to help us kick off today.